My name is Kelly Danis, and I am the Nutrition Director for UPMC Presbyterian, Shadyside. UPMC is a world-renowned facility with over 30 hospitals and 80,000 employees.
My name is Angela Lago, and I'm the Clinical Nutrition Manager at New Hanover Regional Medical Center. New Hanover is an 800-bed hospital serving southeastern North Carolina. As a dietitian, we work on so many different aspects of patient care, and it really became apparent in the last several years that malnutrition is something that was really being overlooked and needed our focus.
We know based on the evidence that 30 to 60% of our patients coming into any hospital door across the country are either malnourished or at high risk for malnutrition. Throughout my career as a dietitian, that's what we do, identify malnutrition and try to bring recognition to that to the interdisciplinary team. And I think after many years, there was finally just enough data and enough evidence that everyone else finally figured it out and understood the importance and the impact that it can have in improving patient outcomes.
We've been on our malnutrition journey at New Hanover for about 1.5 years now. Earlier this year, I was at a nutrition conference and someone from the academy was telling us about the MQii. I just really felt like it was the next right step for New Hanover to really take us to the next level.
The thing that truly sold us was the idea of increased communication and having one true plan of care for our patients.
UPMC is very forward-thinking and looking for more opportunities to advance care. Taking part in MQii fit with the philosophy, and it was a very easy sell to move forward with the initiative.
The biggest thing that I saw is our dietitians took the time to come forward and meet with me and educate me on malnutrition. They were so surprised because they thought they were asking for a lot and the funding was so minimal, but yet the benefit was so huge. And it was an easy decision from my standpoint.
The MQii has established electronic quality measures that will help us identify how well we are screening, assessing, diagnosing, and implementing plans of care. The importance of capturing and identifying that malnutrition during the inpatient stay is even more elevated, knowing that once they're out there in the community, those opportunities do not exist. Pulling the interdisciplinary team together is the most impactful piece of all of this. Every position has its role because malnutrition needs to be treated by everybody.
When I was asked to join the MQii team, it was a simple decision. This is a very important issue that we need to take care of in this country.
When we were building our team, we really wanted to have a very diverse interdisciplinary group. It's really important to have nurses, physicians. We really need someone from the IT department. We wanted to have quality, and especially the dietitians.
The dietitian is really the most important role in identification of malnutrition. They're the expert, and they're the ones that need to identify it and bring it to the attention of the interdisciplinary team so that it can be treated. One of the gaps that we identified was that communication between the dietitian and physician to assure the dietitian was sending a very clear message to the physician for them to fully recognize the level of malnutrition that was present.
I think we need to work, as we are doing now, with the resident dietitian to identify these patients so that we can intervene appropriately.
The dietitians have really been able to champion this program, and with the help of the interdisciplinary team, it's really made it all come together. And I think many times we feel like nutrition isn't as important to other people as it is to us, and through working on this team, I have found out that it's just simply not true.
Anybody can implement MQii into their system. It is work up front, but it is so valuable and so worthwhile in the end that yes, anybody can do it.